There is a receptor in the back of the eye. They only discovered it maybe 10, 15 years ago. It's called an IPRGC, an intrinsically photosensitive retinal ganglion. So only about 10% of the back of the eye has this, and it doesn't communicate vision. It doesn't communicate to the parts of the eye that to your brain that helps you see things. It just relays light information to essential parts of the brain that help you develop melatonin and regulate your sleep-wake cycles, along with some other metabolic things.
Welcome to Salad with a Side of Fries. I'm your host, Jenn Trepeck, talking wellness and weight loss for real life. We're here to clear up the myths, misinformation, bad science, and marketing to teach you how to eat and how to cheat. Are you ready? I'm having salad with a side of fries. Hey friend, welcome back to Salad with a Side of Fries. I'm Jenn Trepeck, your host and health coach, here with you every week for wellness without the weirdness. And whether you're brand new to Salad with a Side of Fries or have been listening since day one back in 2019, this episode is a first. And it is hard to believe, but this is our first episode dedicated to eye health. And I am delighted to bring you someone who is potentially the most perfect fit for us with this conversation. He's a practicing optometrist in Virginia and the founder of Dr. Eye Health, an educational YouTube channel with over 1 million subscribers, where he provides information about eye health, ocular disease, and vision products. He graduated magna cum laude and salutatorian from the Rosenberg School of Optometry in 2015, completed his residency at the Minneapolis VA Medical Center. He's a fellow of the American Academy of Optometry, a diplomat of the American Board of Optometry, and a member of the American Optometric Association Strategic Communications Committee. Now he's joining Salad with a Side of Fries community. Welcome, Dr. Joseph Allen.
Hey, Jen, thank you so much for having me here. This is, again, an honor always to nerd out about eyes and about health and help people out as best I can. So thank you.
Absolutely. I'm thrilled you're here. Welcome. I feel like there's so much that we want to cover in this. So just one more piece of housekeeping, and then we're going to get right into it. So friends, be sure you're a member of the Happy Healthy Hub. Being a member of the Hub is the next best thing to working with me as your health coach. This week, your recipe is for hearty white bean and kale soup. So honestly, even if you're not a kale fan, I think you're going to like this one. You could also change it up and use a different green. But, great to make ahead, have it in the fridge, put it in smaller containers, freeze it. It's delicious and frankly, very fitting for today's focus on eye health. As a member of the Happy Healthy Hub, you get a recipe each week delivered to your inbox, curated articles, additional discounts from me and our partners. You get interview episodes like this one in full video, including behind-the-scenes content, a community board with the ability to post and comment on other people's posts, plus 24/7 AMA or Ask Me Anything to target your specific questions or challenges. You can upvote other people's questions, see past answers, all the things. All of this is yours, by the way, for just $12 a month, or prepay the whole year, get 2 months free. What a bargain. So to join the Hub, go to asaladwithasideofFries.com/membership. From there, you're going to click subscribe. Now, follow the prompts to enter your payment info and create your login to access the Hub, all of your benefits. Remember, you're going to asaladwithasideofFries.com/membership. This supports your health and the show, so we can keep doing this with you every week. Remember, you're going to get this week's recipe for hearty white bean and kale soup. Okay, Dr. Joey, you've become known as Dr. Eye Health. Did you know as a kid that you wanted to be an optometrist?
Yeah, that's always a good question. People do ask me that. So I found out or kind of realized eye care was my thing. So, growing up, I was a bit of a nerdy kid. I spent a lot of time indoors reading. My mother was worked at a library. So I was either reading all the time or playing video games or watching movies. I was very much an indoor kid. My brother was the outdoors kid who went playing baseball and everything. So I ended up needing strong glasses at the age of 6, 7. And when I got into about junior high, about age 13, my mother's like, hey, Joey, you need to pick a sport. And I wanted to do the manly thing, right? I'm going to junior high. I'm 13 now. I'm going to play football. And it's really hard to play tackle football with thick Coke bottle eyeglasses, right? It's like a safety issue. If you do get tackled, you lose them somewhere, then you got to spend the time to find them, all those things. So my mother was a contact lens wearer, so I went to my eye doctor, I got fitted for contacts, and it changed my life. I found myself not only just the freedom of being able to play sports, but that opened the gate to making more friends and making more friends boosted my self-confidence. And at that time in my life, the most important thing, girls started paying attention to me.
I knew you were going to say that.
Yeah, so that's kind of the story I've come to own and just realized like that was a huge moment in my life. And then so when I got into later high school, I knew I liked science. I was interested in it. And I happened to see my eye doctor at around that same time. And they're like, what are you going to do for college? What are you going to do with your career? And so I was like, I asked him, I'm like, well, what's this job like? And kind of set that as my North Star. And that's the path I followed. And that's what took me where I'm at today.
Amazing. And he was an optometrist.
Yes, my eye doctor was an optometrist and back in St. Cloud, Minnesota. So shout out to Dr. Sufka.
Yeah. I love it. We're both Midwesterners. Okay, so here's my question, because there's optometrists, ophthalmologists.
Mhm.
Let's help everybody sort of even just understand the various like specialties.
Right. So that's a great question. So here in the United States, and I have to preface that because every country is a little bit different on how they organize these professions. And some countries don't even have like a doctor of optometry. But in the United States, there is an optician who may have a certification, and they are individuals who work at an eye clinic or an optical and really help you fit glasses to your face, like your glasses that you're wearing right now, to make sure it's fitting correctly, not just so that it fits for your face aesthetically, but so that the lenses, because the lenses and where they're placed on your face do make a difference of how you see through those lenses, which is an issue sometimes when people go online and they buy glasses that they really have no idea what they're doing. So I think you can get great successful glasses buying online, but you have to have some idea of like where, like how glasses are supposed to fit on your face. So an optician will help you fit for your glasses. Sometimes they have education on fitting contact lenses and things like that. And they really understand and know the different lens materials and how they fit for your face. So that is an optician in the United States. Then a doctor of optometry, we not only go to undergraduate pre-med for 4 years, then you have to get into an optometry school, which is another 4 years. And there you learn everything about pathology, anatomy, pharmacology, various ocular diseases, treatments for those diseases, certainly all the techniques of fitting contact lenses of every kind, specialty lenses. You have to learn some level of surgical techniques, anything that's done in the office. So we do use lasers to treat glaucoma. We'll do foreign body removals, anything on the surface of the eye, or a few surgical procedures that don't cut into the eye. As soon as you're doing an invasive surgical procedure like cataract surgery, you are doing something like retinal surgery, anything like that. That is where you go see an ophthalmologist. So an ophthalmologist, I know it's like, oh my gosh, there's all these new terms, but an ophthalmologist is a doctor who first went to their undergrad for pre-med. Then they went to more traditional medical school or doctor of osteopathy. So they either got their MD or DO. And then they decided, hey, I really love the eyes. I want to study the eyes for another 3 to potentially 7 more years. and they mainly learn not just clinical skills, but they learn a lot of surgical techniques and advanced focus on disease processes. And so there are some ophthalmologists who specialize in pediatric eye care, and they mainly do like strabismus eye surgery. So if you see those videos of kids who have an eye that's turning way in or way out, and that can't be corrected through some other means, and they need surgery, those are the specialists who's going to correct that. There's ophthalmologists who specialize in just corneal refractive surgery. So if you want to have LASIK, or if you need some other advanced corneal procedure because of a disease or an injury, there's someone who's just going to deal with that. And then there's specialists who do just glaucoma or just retinal diseases. And there's even some MDs who decide, you know what, I don't like surgery, even though they did all this training in it. They actually really enjoy dry eye disease, or they really love rheumatoid or inflammatory disorders of the eye, or what's called uveitis. And they'll specialize in that. So there's not a ton of ophthalmologists. There's actually an issue where there's not as many ophthalmologists or doctors going into that specialty. And so the profession of optometry has had to step up, and our education has gotten more and more robust as a profession too. So that's at least in the US, and that's kind of where we're at. But just knowing for wherever you live at, if anybody's listening and they live in the US, understand that every state has their own laws. So some states, even though doctors of optometry are trained to prescribe medications, there's some states that don't allow us to prescribe medications for things like glaucoma or even infection on sometimes. But most states do. but it is a legislated profession. So it's something just to understand that, hey, like I used to practice in the state of Minnesota, and some patients would see me and then I couldn't treat them with a certain condition, but they would go 5 miles over the border into Wisconsin and there I could treat them. So it's sometimes a little weird, but
Yeah.
sorry for the long-winded answer, but there's a lot of nuance to it. So I understand why people are confused. So we just need to be better about educating people on what that is.
Yeah. And I think another piece of educating people is part of why we're here today. And one of the things that I often hear, and you mentioned this, is that people think they don't need an eye doctor until they can't see or until there's pain. And you said to me, that's far too late. So talk to us a little bit about why we really need regular eye care and, beyond just seeing,
Right.
or even why seeing is so important.
So yes, this is a huge message. And I even just asked a person, I went to the gym the other day with my friend, and I asked one of the coaches there, like, hey, we kind of introduced and had a conversation. I mentioned I'm an eye doctor, and he's like, wow, I haven't been to the eye doctor in like 15 years. And I'm like, because he sees great. He's like, I don't have any vision problems. I'm like, it's not just about your ability to see. There's so much health issues inside of the eye that we often say, yes, the eyes are the window to the soul. I'm sure people have heard that, but really they're a window to your health. The eye is the only clear, like optical medium that we can see through and visualize your blood vessels and nerves and the function of your brain in like real time. And that's us again, because we can actually see through the structures of the eye and see the retinal tissue. And your retinal tissue in the back of the eye is an extension of your brain. So we can directly look at your cranial nerve 2, the optic nerve. We can see how that's healthy. We can see the blood vessels in the back of the eye. If somebody's bleeding from high blood pressure, from diabetes, if they have cholesterol plaques stuck in the eye, we know that they're at really high risk of having a stroke or that there's maybe a blockage in the carotid artery. We can catch autoimmune diseases by looking inside the eye. We can catch, unfortunately, I don't like it when we have people who have brain tumors or cancer, but we do catch that too. And there's beyond, as we get older, neurological diseases show up in the eye because of the way the ocular movements are involved. We catch young kids with either cancers of the eye, sometimes autoimmune conditions in children. So there's a lot of things that we catch. And most eye diseases that are going to cause permanent vision loss, you don't recognize that there's a vision issue brewing until it is too late. Because we've evolved as a species, as humans, to prioritize vision as like utmost importance because it is so critical to our survival. Yes, people obviously who have vision loss are diagnosed with legal blindness. They still can live amazing, successful, happy lives. But if you imagine 10,000 years ago, if you couldn't see, there's a really good chance you're either going to become food or you're going to have a hard time finding resources and surviving. And so the function of the eye will hold on to having good, crisp vision. And then as soon as it starts to decay, it's again, the disease process has already been brewing for a long time. For example, conditions like macular degeneration are before somebody even has like a vision loss change, it's probably been brewing for at least a decade or more, sometimes 20 years before they start to have significant vision loss where they would be like, I just can't see as well, or I'm seeing spots. Glaucoma is even worse. Glaucoma is where the optic nerve in the back of the eye slowly dies over time. And usually people have elevated eye pressures and they think, oh, well, my eye, I don't feel pressure. Well, no, you wouldn't. The only time you will feel elevated pressure in your eye that's going to cause damage is when it's alarmingly super high. And it won't feel like pressure in the eye. It'll be like, I have the worst headache I've ever had in my life. My eyes are red. My vision is cloudy. And that's in a very specific condition where somebody has an angle closure. And those,
because there aren't like pain receptors there, right?
You're right. So the eye's interesting that the surface of the eye has the most dense amount of nerve fibers, because if you've ever had a scratch in your eye or even just an eyelash, right? If you had an eyelash get in your eye, it feels like a boulder or like a razor blade. You have the most dense amount of nerve fibers in the front surface of the eye, and it's there to protect it because, again, the eye is so important. But the back of the eye, where all the nerves, the nerve fibers, and the blood vessels are, because the retina structure does not have those pain receptors. So if somebody is bleeding in the eye because of their platelet levels are very low, or they have, again, diabetes or high blood pressure issues, some metabolic disorder, their vision may be fine, but if I look in, I can see all these hemorrhaging, like the tissue is bleeding, but they won't know. Not until they come in and they have somebody take a look. And again, they may see spots in their vision at some point, but by that's occurring, it's like, oh, you're already in advanced stages of the disease where we have very limited options for treatment. So again, if we can catch things early, and I do have patients almost every week who come in and they're just having, oh, I just need my glasses updated, or I just need my contact lenses renewed. I'm seeing just fine. And I look inside, I'm like, oh, see all these blood spots in this pattern? Like, we have to send you for blood work. We have to send you back to your family doctor. You probably have elevated blood sugars, and they've probably been elevated for some time. End up with a diagnosis of diabetes, which is tough, but also great that we're catching it so early. Again, because if we can catch it early, we can make lifestyle changes. We can talk about diet. We can talk about exercise. We can get them on medications, anything to help them. And then we can, even in some cases, put that disease into remission. So yeah, getting in regularly is really important.
Yeah, and regularly is annually.
It is, yeah. So
okay.
There's been debates about like how often should we have the eyes checked. So the American Optometric Association put together a commission of not just optometrists, but ophthalmologists, and then they put pediatricians, and they brought in librarians and all sorts of different professionals to look at the data of like, okay, well, how often do people really need an eye exam? And it ultimately fell on no, annually is by far the best. I had a patient who's works at an insurance company, like a health insurance company. And he came in, he's like, I don't have any vision issues, but I've ran the numbers. This is the single most important health exam where you can catch the most diseases for like the lowest cost of time and effort without having to be invasive. Like we don't have to do a blood draw. And I'm like, wow, this is like the best vote of confidence for this profession. I wish I could have that on tape.
I love it. And we'll dig into more of the lifestyle choices and interventions and things like that in a second.
Yeah.
I also want to ask you about how stress impacts the eye.
Yeah, stress is fascinating. This is something I've been diving into more in the last few years, probably because of my own stress and like what's going on.
Funny how that happens. Right.
But even in like we learn about this when you're in optometry school. There's a few conditions in the eye where stress shows up. Probably the most common one that people come in with, and maybe some people listening or viewing, probably are having this right now. And it's eyelid twitching, where you feel like your eyelid is kind of fluttering, right? So if you ever had like an eyelid twitch and just sort of flutters off to the side a little bit, it's really annoying. And you're like, what is going on? And maybe it'll last a few days, but some people come in, they're like, I've had this for 3 months.
Oh my goodness.
It's not going away, and people are worried that you're like you're not winking at somebody, but you can feel it and it's kind of getting in the way of things and it's just annoying. So usually when somebody does have an eyelid twitch or what's called an eyelid myokymia, it's due to stress, it's due to fatigue, and sometimes elevated intakes of things like caffeine or other stimulants. And what's joked about in the medical textbooks, it's often called like the medical student condition or the medical student disease, because all the med students were like really high performers. They're very stressed out because they've got so many tests, and they're like, I need to get into this residency, and they're very competitive individuals. And so they'll come in and they've just like, I've had this for 3-4 months. And it's because they're not sleeping well. They're taking lots of stimulants and stress. So that's primarily what's going on with those. There's a few things in the research that have showed, this may help, putting a cold compress on the eyelid to settle it down. There's some few isolated studies on supplementation, but nothing really concrete. The most solid, consistent thing is cut out some of the caffeine, focus and prioritize your rest. And, I'm always like, if I could prescribe a massage, go do some yoga or something, then I've even written that for a few patients. Like, I need you to take it easy. For other extreme cases of stress, they can show up in the eyes in different ways too. Some people will come in because their vision has changed, or they're seeing wavy distortions in their vision, or things seem magnified or minified. And during an eye exam, we'll look inside the eye and we'll do an instrument called an OCT, an optical coherence tomographer. Yay, fancy keyword of the day, right? It's basically getting an MRI of the eyeball in a way. And it can show us that the retinal tissue is swollen. It's actually swollen up like a blister, like the blister on your finger that you can get, except it would be a blister in the back of the eye. And this we call central serous chorioretinopathy, another fancy word. But this is something that can develop usually for some people, it's just because they're taking either exogenous steroids or corticosteroids, either because they have arthritis or they have, thrown up back, so they need a cortisone shot or something. So you can get it from exogenous cortisol, but a lot of times it's from endogenous cortisol, right? They're really stressed out individuals. I'll have a patient come in and I can just tell, from the way they hold themselves in the office chair that they are under an immense amount of stress. And sure enough, I'll ask them like, hey, how are you doing? What's going on in life? And I've had patients break down and just tell me like, I'm going through divorce, or I was diagnosed with cancer or something. And sure enough, they have this blister forming in the back of the eye, and it's from their stress response, all the cortisol releasing from their adrenal glands. And thankfully, most cases of that, once things settle down, within 3 months, it resolves on its own. But there are some people where that response remains for longer than 3 months. And in those cases, we have to consider if there's additional therapies that need to be tried, because if it stays swollen for too long, it may increase the risk of vision loss and other deformations of the eye. Interesting. Just as a side comment, because I know we're kind of interested in lifestyle things.
Yeah.
So for that condition, the last 6-7 years, they've been researching the use of melatonin supplements to help treat that disease. And it's questionable. They don't know if is it just because the melatonin is helping people relax and get better sleep, which is a lot of times these stressed out people are not getting better sleep, or is it because melatonin is such a strong antioxidant because it does get into the retina, and they're kind of wondering if that has a role with the swelling that's occurring with this condition. So that's at least one kind of interesting area I've been following for about 5 or 6 years, that kind of research for that specific condition. So yeah, melatonin, whether you're taking it as a supplement or if you're just getting it naturally because your brain is developing it, that has a positive benefit for the eye in some situations.
Yeah. Okay. I have so many questions. I want to talk about a couple other conditions, what causes it, and then the stuff like melatonin that maybe, and better sleep that we can do. Really quick though, let's pause here to highlight our partner for this episode. You know how wellness the wellness world just loves to bury us in rules, in guilt, and all of that noise. Yeah. So that's why I wrote The Antidote. My book, Uncomplicating Wellness, Ditch the Rules, Quiet the Noise, Reclaim Your Life, is for anyone who's ever felt like they're doing everything right, in air quotes, but still not feeling well, not feeling energized, not seeing the results of all of that effort. Full disclosure, this is not another plan. It is not another diet book. Just like this podcast, it's fries with your salad. So it's part science, part permission, and zero guilt. We'll clear the chaos, call out the perfectionism for what it is, and help you build trust in the one expert who truly matters. That's you. So if you're ready to stop chasing wellness and start living it, grab your copy of Uncomplicating Wellness. Let's ditch the rules, quiet the noise, and help you reclaim your life. So find Uncomplicating Wellness wherever books are sold, or text the word book, BOOK, to 833-801-0500. We'll send you a link to learn more and find places to purchase. Again, text the word book, BOOK, to 833-801-0500. Let's move from exhaustion to clarity, from fear to discernment, and from chasing healthy to truly feeling well on your own terms. Okay, Dr. Joey, I want to start with some of the cosmetic things because, like we said, maybe their vision's fine when it comes to their eyes. That's, not their primary concern. But what causes some of those cosmetic things like bags under the eyes, dark circles, puffy eyes, red eyes as a whole can of worms? But
Yeah. So this is a popular topic, certainly online. People are always asking because they're always concerned, my eyes look really tired. Like even right now, maybe people are watching, they're like, even Dr. Allen's eyes look maybe a little dark. But so there's many different causes for hyperpigmentation around the eyes. And then there are the sagging kind of bag appearance to the eyelids. They're technically two different things, but a lot of times people kind of confuse the two. Because if you have swollen eyelids or these eye bags, they can cause a shadowing effect, or they can cause fluid distension. And depending on your skin tone, the blood vessels underneath may look more obvious. And so that's going to look kind of this darker blue, purplish hue. And so then people think, oh, I have this pigmentation or these dark circles. Well, again, there's technically two different things going on. So first, if you have true hyperpigmentation, if you're somebody who just looks in the mirror and your skin around the eyes is visibly a darker pigment, that can either be because of one, genetics, which is really tough to deal with, right? Then there could be that somebody has photo aging of the skin around the eyes, and that's just from sunlight exposure. So it is beneficial to wear wide brim hats, to wear sunglasses, protect the delicate, thinnest skin on the body, which is your eyelids, protect it from sunlight or harsh UV light damage. So that's just one note, because over time that can make it worse. There are certainly treatments to like laser procedures and things like that can be used from a dermatologist or some oculoplastic specialists who will basically remove some of the hyperpigmentation if it's something that's related to genetics or something. But then eye bags, that's the one I think most people are frustrated with, because they wake up from a long night, they went and partied over the weekend or something, they enjoyed themselves, but they wake up the next morning and their eyelids are puffy. They look, they're unsatisfied with how that looks. And so this can be because either fluid distension or changes due to salt imbalance of the tear film and just how their facial tissues swell. Thankfully, this usually resolves within 2 hours of waking up, right? After a few hours, you're like, I look so much better. And doing a cold pack, that's been around for decades and decades. Just getting an ice mask. They sell there's different brands. I've got like 2 different brands in my freezer. But if you wake up, want to put a cold pack on in the first few minutes of the day, that will help constrict the blood vessels and make things look less puffy. Now, some people, just as we age, our collagen in our skin does change. And so skin does sag more. We do get more wrinkles and fine lines. And so naturally, we do start to develop more of this saggy bag appearance. There are, of course, eye creams that you can buy. Those can have a benefit of reducing the development of fine lines and wrinkles. There's even some eye creams or eye bag creams that are more like a glue, and they actually tighten up, and they do remove the appearance of those bags, but it's a temporary fix. It's not going to be like every day. Basically, every day you're going to have to keep reapplying that. There are long-term, again, the septum, which is a tissue around the eyelids that holds the orbital fat around the eyes closer to the face. That septum does loosen. And so then orbital fat begins to bulge outward. And this is when we're into our 60s and above. In those cases, whether they're eye creams or whatnot, those aren't going to really solve the issue. In that case, most likely you'll have to see an oculoplastic surgeon. This is a plastic surgeon who specializes around the eyes, and they can tighten and do like an eyelid lifts and things like that. And they can actually remove a lot of that orbital fat and help with that appearance. Otherwise, especially with fine lines and wrinkles these days, there is a fascinating connection of these kind of eye bags and eyelid changes that connect to dry eye disease. Because if your eyelid, we'll say the tone of your eyelids has changed, then how your eyes blink and come together individually with each blink changes. And so we now have a lot of treatments that are coming out, such as radio frequency treatments, intense pulse light or IPL treatments, and some others like microneedling that is being utilized by specialists around the eyelids to not just remove fine lines and wrinkles. That's a great kind of side effect, but to tighten the area around the eyelid to improve like appositional blink of how the eyes blink on the surface of the eye and maintain tear film distribution. Sorry, I kind of dove onto that, but it's a fascinating area of how everything's connected. So that's just something kind of neat to think about.
Yeah, well, and I think part of what's so interesting about it is that, again, our, U.S. especially, but Western medical system separates everything.
Sure.
And what we're really focused on, funny you said before, eyes are the window to your health, because that is what I had named this episode before we were ever, before we started recording. But even in thinking about it, right? Like we see it also with dental care, that some of these things are really giving us an indication of what's happening inside the body. And the more we try to separate it, the more we misunderstand the human body, I think. So let's talk about, diabetes, thyroid.
Mm-hmm.
You mentioned a whole bunch of Alzheimer's, right? It's things that impair cognitive health you see all the time.
Right.
How do those things really impact the eye? Is it all just on this inflammation, blood flow kind of piece, or what might we experience
Yeah.
that says, figure this out?
I think, well, one, fundamentally, if you really boil down and understand the pathophysiology of what's going on, yes, that is a big part of it, right? With diabetes, it's about blood flow. Yes, when people are diabetic, they have a hard time controlling glucose for one reason or insulin secretion. But ultimately, what happens when their glucose levels are too high, the sugars end up getting into a cell on the inner lining of your blood vessels called a pericyte, not a parasite like a microorganism, but a pericyte. And these pericytes, they regulate how your blood vessel dilates, shrinks, and then also allows for nutrients to pass through the blood vessel. And so when these pericytes absorb too much glucose, they swell and then they burst and die. And so if this occurs over a long enough time, you lose enough of these regulatory pericytes, and then these fine blood vessels in the back of the eye start to leak fluid. And this is really important for anybody who is diabetic, because if we catch bleeding in the eye, then we know this is also occurring in the liver, this is occurring in the kidneys, this is probably occurring in the brain. That's why it's so important for not just to see your eye doctor to make sure that, hey, you're not going to lose vision, but because we can communicate this information to your family doctor or an endocrinologist so they know, oh, this isn't just a normal or low risk case of diabetes. We need to be more aggressive about managing it. But diabetes eventually causes inflammation in the eye too, and it begins a whole other cascade of events. Thyroid, you mentioned. I'm glad you brought that up because I know we've had a previous discussion about that. Thyroid is something I'm always being aware of, because the patients will come in and maybe one eyelid will be slightly above the other, or they're having minor cases of double vision, or they in fact have dry eye disease, because the thyroid plays so many different roles with the eyelids, the eye muscles, and can affect the lacrimal gland and tear production. So there's a lot of things we have to be aware of when somebody's coming in, there's something going on with the eyelids. Thyroid is always one of the first things I always check. And then, gosh, there's so many different things that affect the eye. I know you mentioned, again, Alzheimer's, and that's a big area that's being studied well, is whether it be something like Alzheimer's or any sort of dementia of any kind. And the reason for that is because, again, not only does the optic nerve in the back of the eye potentially change, and all the retinal fibers inside the eye, which connect to the optic nerve, but the control of the eye movements is, in fact, impacted by every single lobe of the brain. And so if you're having difficulty shifting your eyes from left to right while you're reading, or looking from top to bottom, if you're looking from something in the distance to up close, or your motion sickness, there's so many different things that the eyes are constantly doing. And again, it takes really fine motor control and communication from all these different parts of the brain. And so they're now looking at eye movements as a way to track and potentially detect and monitor for improvement or response to medication for both the diagnosis and the management of monitoring neurological conditions. And we already do a lot of that for people who've had concussions or brain injury for some reason, right? They get into a bad car accident, or they get in bad sports injury. Like I had a concussion back in March.
What were you doing?
I was snowboarding. Sadly, we don't know what happened, but obviously somehow I got hurt. And the irony of that is I was there because my girlfriend, she was speaking at the International Congress of Brain Injury that next day.
Of course.
And so I was hanging out the next day with all these top researchers from all these institutions around the world who are researching brain injury, and they're asking me all these questions. It was kind of a crazy experience, but thankfully I'm all healed up and doing great.
Yeah.
A big key takeaway I just want to mention for everybody is just, again, recognize how interconnected everything is and how much we can detect from looking inside the eye. And so much of our lifestyle does impact our ocular health. And obviously, again, it's a reflection of everything inside. And so I know everybody who's listening in obviously is cares about their health in some way. But huge just kudos to you for your book, for that huge achievement for you. I think writing a book is a huge deal. But then making it not only science-driven, but making it reachable, attainable.
Yeah.
Again, nobody's perfect. And that's hard for me to admit for a professional who's been driving and is, addicted to achievement and things like that. But it's perfectionism, you have to pull away from it. And it's a tough thing to get over.
For sure. And that's a perfect segue into all the lifestyle things. But one thing that has been floating around my mind since we started talking, and I'm I have to ask about this because I'm seeing it a lot. A lot might be aggressive, but more often than one would think. And that's detached retina.
Yeah. So one of the biggest things I would say, even before detached retina, is eye floaters, right? Do you see eye floaters? Do you see little specks in your vision?
Occasionally, but I've been told it's like makeup stuck in the back of my eye from like
Well, that happens too, actually. It's kind of
Yeah.
crazy how often we flip eyelids or look underneath and we'll catch like mascara that's like trapped in the conjunctival tissue. So that's a whole other thing. So a lot of people will come in, or at some point in their life will start to notice, hey, if they shift their eyes side to side, if it's a cloudy day or on the back of a brightly lit computer screen, they're like, I see these floating spots or cobwebs, these little streaks kind of floating around. Most of the eye, the actual volume of the eye, is a gel called the vitreous humor. And it basically holds the shape of the eye. Like think of a water balloon, right? The gel is the water inside the water balloon. It's mostly water with a little bit of type 2 collagen and some hyaluronic acid. That's all it is. Well, as we age and collagen changes, again, our skin sags as we age, the collagen and the gel inside the eye starts to break down and clump together. And so they kind of sit inside of the eye in front of the retina. And if light hits the right way, it'll cast a shadow on the retina and you see these little wisps and strands floating around. Now, if this is just small ones, usually that's okay. Still something good to mention to your doctor so that they can look inside and sometimes we can see them even. The challenge is that sometimes people will have a sudden, whoa, I'm having like 100 new floaters, or they see a flash of light. Or even sometimes they'll see like, I see this dark curtain in the side of my vision or coming up from the floor. And then they, unfortunately, some people will put it off for a few weeks and they're like, oh, it'll get better on its own. No, thankfully, a lot of people who do have these symptoms get in to see the eye doctor soon because we have to dilate the eyes. We make the pupil really big so we can look inside and we look in all the edges because we want to make sure that the gel, as it started to degenerate, didn't kind of collapse in on itself and pull part of the retina with it. Because some people will form a little tear. It's kind of like pulling a piece of wallpaper off the wall. It can tear the retina, create a hole, or full-blown pull the retina off the back of the eye, which we call a retinal detachment. In those cases, retinal detachments, if we catch it early, we can either use a laser to tack it down. There's a couple different procedures, but they can either catch it early and tack it down before it becomes a problem. But if it becomes a full detachment, then usually having to see a retina specialist to have a surgery to get the retina back intact with the retina wall or the eyeball's wall, because it can lead to permanent vision loss and blindness. And so that's probably the biggest telltale signs for people. If you see new sudden floaters, new flashes of light, and any kind of loss or shadows in your vision, don't put it off. Get in to see your doctor as soon as you can, because it's amazing how many messages I get like, thank you so much for talking about this because I went in and I had my procedure, but they saved my eyesight. So just want people to be aware of that.
Dr. Joey, the hero. So, all right, let's talk about all the lifestyle things, right? That we're nutrition, lifestyle. You've already mentioned a few, but I'd love to hear some of the recommendations that you make all the time for eye health, cognitive health, those kinds of pieces.
Yeah. So probably the biggest one I would say, and you kind of, I love that your recipe that you shared at the kind of the beginning mentioned at least some greens in there, right? Kale, or if somebody doesn't like the taste of kale and they're working up to it, maybe spinach or something. So green leafy vegetables do have not just the great things of fiber and all these like phytonutrients. There is something called lutein and something called zeaxanthin. These are dietary carotenoids. There's over 700 some in nature. Usually in our diet, we only have about 50 some that we actually consume. And then of all of those, 2 go directly to the eye and they deposit in the eye in very critical areas for vision and for protecting the eye. So in the back of the eye, the entire retina does gain this lutein. It deposits inside in the retina, and lutein is kind of a yellow-orange colored substance. You not only get lutein from green leafy vegetables, you get them really high concentrations in green leafy vegetables, but you also get some in like paprika, some other peppers. There's a little bit in avocado, in pistachio nuts, and there's a little bit in egg yolk as well. The lutein filters blue light, which a lot of people are concerned about blue light. They get blue light glasses and things like that. But your body has naturally evolved to defend against high energy blue light by depositing lutein to work as a filter, preventing not only the blue light from getting to the back of the eye, but lutein also works as a powerful antioxidant and as an anti-inflammatory within the tissues. And then Zeaxanthin works similarly. It's just deposited in higher concentrations in the dead center of the back of the eye, kind of like the bullseye. If we're playing darts at a pub, the central part of your vision uses a lot of zeaxanthin. And then there's even a third one called mesozeaxanthin, which is actually your body generates on its own within the retina from lutein. And then there's some even supplements that have all three that people will take. But naturally, just with diet alone, if you eat enough green leafy vegetables, we'll say carotenoids are fat soluble. So as long as you're using a little bit of oil, either in your salad or, you can eat a handful of nuts or something. And that's why, even though there's not much lutein in eggs, there's more fat there. So people do have a little higher bioavailability with them. So lutein, zeaxanthin, and mesozeaxanthin are really important, and that you can get just from eating. As people get higher amounts, they have higher amounts of pigment in the back of the eye. And we can detect that and measure that with some instruments in the eye clinic. And people who have higher pigments in the back of the eye, they have less risk of aging eye diseases like macular degeneration, for example. And there's also studies that show people who have higher amounts also have better contrast. So they actually see colors and differences in small details a little bit easier and better. They also have less glare when they're either driving at nighttime or less glare off of computer screens and their phone screens. And they've done more studies looking at people's memory functions, their visual processing for both adults and children. As you can tell, I've read a lot on this because I think it's fascinating.
I love it. Me too.
And then just the other year, they did a really cool publication that found that people who they were specifically using supplementation with lutein, zeaxanthin, and mesozeaxanthin. In that supplement study, they found that people who had taken the supplement had reduced levels of low-density oxidized lipoproteins and lower levels of inflammatory markers that are associated with atherosclerosis and leading to stroke and heart attack. And so there may be some other implications for making sure you get these essential nutrients in the body, more so than just the eyes and the brain, but the whole body. So that's a huge one. And then, so I'm really happy that you emphasize that. Another nutrient that's really good to get into just diet food-wise are omega-3s. I'm sure you've done plenty of episodes on maybe mentioning omega-3s, but omega-3s are essential for the retina in the back of the eye. They account for about 50 to 60% of the lipids in the back of the retina are all DHA omega-3s. And at least epidemiological studies show that people who do consume more fish, oily fish like salmon, mackerel, herring, at least twice a week, if you're looking at just fish, it's like 24% reduction in risk of aging eye diseases and progression. If you combine people who eat that much oily fish at least twice a week with 2 to 3 servings, that's not much, right? 2 to 3 servings of green leafy vegetables, and you combine them, then there's about a 45% reduction in risk of developing aging eye diseases like macular degeneration. So there's definitely
significant.
Yeah, it's a significant thing. So I wish more people would just take that one little thing, that one small step. So those are at least 2, dietary things considering, making sure you get regular amounts of omega-3s, whether you're getting that from fish sources, algal sources. I try to go from the natural fish source personally. There are, of course, supplementation. That's another way to go. There's ways to check your omega-3 levels if you're not sure how much you're getting in your diet or if you're from your supplements. And then lutein, zeaxanthin, mesozeaxanthin, whether you're getting it from your diet or you want to take it from a supplement, research has shown positive effects with both avenues.
Yeah, and then let's talk lifestyle. Like, I'm curious about, you mentioned getting outside, which I think is so interesting, and cleaning the eyelids.
Yeah, so getting outside is really a fascinating area. I think there's a lot of emerging science starting to understand things better now. Certainly, maybe you've heard doctors, even myself earlier, I'm always said, concerned about UV light. So the sun obviously emits all wavelengths of light. We are concerned that UV or ultraviolet light can age the skin. It also is known to cause oxidative stress within the eye for how much can penetrate in. So we do recommend during high UV peak hours of the day, consider wearing sunglasses, wide brim hats, something like that. But there are benefits to natural sunlight and being outside too, mainly from red light and potentially infrared light. And so a lot of research right now is coming into understanding the impacts of like red light devices, wavelengths of light, energies of that light that may have a positive or beneficial effect on the eyes. This is being studied not only for dry eye disease and the effects of the eyelids, but it was just FDA approved in a specific device for macular degeneration treatment. They're also researching it heavily, especially in Eastern Asia, for treatment of myopia or nearsightedness in young kids. Right now, there's still really a lot of caution around safety because they're trying to titrate the right amount of energy with these red light devices because they don't want to cause damage because, if you stare at a light that's at too much energy, like staring at the sun, you can burn a hole in the eye. So they're being very cautious about
It's a fine line. Yeah.
But they do know, at least when it comes to kids who are at risk of myopia, they do recommend at least getting 2 hours of outdoor playtime every day. They can't say, is it purely because of the light exposure, because of whether it be vitamin D, infrared light, red light exposure, or if it's just being outside in like a wide open space versus being indoors in like a small apartment or looking at a phone in front of their eyes. But they do know that when people start that lifestyle adjustment, that their chances of myopia development does decrease. And so it kind of offsets all the time they spend indoors reading, studying, doing homework, things like that. So it seems to be that there is some benefit to getting natural sunlight every day. Plus, there is the benefit of sunlight does help regulate our circadian rhythm, and which is important for sleep, right? So
back to that melatonin.
Yeah. There is a receptor in the back of the eye. They only discovered it maybe 10, 15 years ago. It's called an IPRGC, an intrinsically photosensitive retinal ganglion. So only about 10% of the back of the eye has this, and it doesn't communicate vision. It doesn't communicate to the parts of the eye to your brain that helps you see things. It just relays light information to essential parts of the brain that help you develop melatonin and regulate your sleep-wake cycles, along with some other metabolic things that they still don't fully understand, but they know it has some effect on our metabolism too. So when you wake up and you open your eyes and you see natural sunlight or even artificial light to some extent, these IPRGCs, they are very sensitive to all light, but they're really sensitive to blue light, high energy wavelengths of light. And so that tells your brain, hey, the sun is out, shut down the melatonin production, let's delay that. And then once the sun sets in the evening, assuming you don't have artificial light, which we're surrounded by all the time now, then that goes down and your melatonin production starts ramping up because it's trying to get you sleepy and restful for a good night's sleep. And so some people are concerned about blue light exposure in the evening if you're in front of computer screens and things like that. Some people can go the route of the darker red, blue light, black blocking glasses. I know researchers in the field are debate if they're really making a significant clinical effect. So probably the best thing is just get away from the devices, switch your lights in the room to a yellow filtered light. Those are things people can try. But I know some people they have evidence too in the research that if you want to go the route of blue light glasses, as long as they're darker orange type of lenses, they can be effective at helping improve the melatonin production. The question is, how clinically significant is it? So there's still some question and debate in that. But sleep, they're finding more evidence that sleep affects not only the health of the back of the eye, but also for the surface of the eye. They even find that one night of reduced sleep significantly alters your tear production. And so people may feel that. They're like, my eyes feel gritty, sandy in the evening once I'm getting tired, or in the morning and they didn't sleep well. They're like, my eyes don't feel good. Well, the salt levels in your tears start going way up. So your electrolytes in your tears, because if you've ever tasted your tears, if you've cried, they taste salty. And that's because there's electrolytes in your tear film. And if the electrolytes get too high, it's like swimming in salt water. It's irritating to the tissue, and it actually causes more damage and inflammation to the ocular surface. So not only do they notice that with decreased sleep does your tear production go down, but then your salt levels go up, and then you have more inflammation on the surface. And that's after just one night of reduced
And that goes back to the puffy eyes that you were talking about before,
Exactly.
too. So we have come full circle, right?
And then if there's inflammation, then your blood vessels dilate, and then your eyes look red. So again, it 100% does come full circle. So sleep is also something that they're looking at for glaucoma, for diabetes, for macular degeneration, for all these conditions. So unfortunately, a lot of us in our modern age, we are working longer hours. We're waking up earlier. We're usually staying up extra nights, hours in the day scrolling our phones. And so whether it be adults or even teenagers. So it definitely affects us.
Yeah. And then that blue light hitting the receptors and the scrolling and it's a whole can of worms.
Yeah.
Right. All right. Final thought to wrap this up, and then we'll do our rapid fire off topic questions.
There was one other question I swear that we had beyond sleep and lifestyle things. I'm trying to think. Oh yeah, cleaning of the eyelids.
Oh, yes. Thank you.
So cleaning of the eyelids is something I'm trying to advocate more for. And not just myself, but a lot of specialists who specialize in dry eye disease or anterior segment disease, which is something that I've really fallen into. I had bad dry eye from high school from being a contact lens wearer and staying up late at night, staring at computer screens. And so that's kind of an area that I focus on. So what people don't think about, right? If you imagine if you were never trained from a young age to brush your teeth, right? What if somebody never told you brush your teeth twice a day, never floss? Then you'd go in, your teeth would eventually start rotting, right? You'd have gum disease, your gums would be inflamed, and then your teeth would start to fall out, and you'd go to the dentist, and it would be not only expensive to fix that, but it'd be painful, irritating, and eventually you'd lose all your teeth. So think about the eyes. When is the last time you cleaned your eyelids, right? Most people avoid washing their eyelids. They don't want soap or water in the eyes because it stings, it irritates you. So we've kind of learned to avoid it. Well, over time, because you're not cleaning the eyelids, there is small amounts of inflammation building up. There are skin oils. There are bacteria, microorganisms that are living and brewing these little biofilms. The term biofilm is debated if that's an appropriate term to call it, but that gives the best kind of image. It's like this swamp that is sort of building up on the lashes and your eyelids. Yeah. It's even, I hate to say it's worse for makeup wearers, because a lot of times you're putting stuff on the eyelid. Well, a lot of that swamp is ending up on like your mascara brush, and then you're putting it in the mascara tube, and then it's sitting there and brewing for several days, and then you're putting it back on the lashes. And so we see higher levels of inflammation in the eyelids and on the surface of the eye. And again, on a long enough timeline, this causes disruption and damage, specifically to oil glands on the eyelid called the meibomian glands. Now, meibomian glands, they produce an oil that every time you blink, this little bit of oil comes out and it stabilizes your tear film. If you don't have those oil glands, your tears will evaporate instantly. And so people who have severe meibomian gland dysfunction or this damaged oil glands, their vision, imagine if you've ever driven during a rainstorm and your windshield wipers are on full blast and you have to slow down because it's downpouring so hard. It's kind of scary. You have to like white knuckle the steering wheel. You have to like wait in between the different wiper blades coming back and forth. That's what life is like for people with severe meibomian gland dysfunction. But the wiper blades are their blinking of their eyes. So because their tear film is so unstable, it's like they can't see, their vision fluctuating, it's blurry, and then their eyes are in pain because they're dry all the time. So it can become rather debilitating. So cleaning of the eyelids is something I wish people would do on a regular basis, ideally daily, or at least every other day, or more often if your doctor instructs you to, because some people do need it more often, based on skin conditions, oil production. There's even a mite. There's an eyelid mite called the Demodex mite, and that loves to infest into the glands of the eyelid, and they are known to be a common cause of sty formation, or they're at least associated with the development of meibomian gland dysfunction, and they're associated with development of dry eye disease because of that. So this is something that eye doctors can detect, and we often do need to treat now with whether it be medications or in-office procedures, but at least regular cleaning of the eyelid.
And what is it? Just water, soap and water?
Yeah, thanks for asking. Sorry, I get long-winded on this. But the best thing to do is actually they do make eyelid shampoos and cleansers now that are safe for eyelid friendly, that don't have chemicals that are disrupt the tear film. Because historically, for probably the last 50, 60 years, all the medical textbooks just said, use baby shampoo. Well, baby shampoo is effective at removing the oils from the eyelid, and they have found that they do actually disrupt the mucus-producing glands of the eye. And so it may actually cause more disruption long-term if people are consistently using just baby shampoo. And that was based off a study in 2017 that was done. So there are different brands of eyelid cleansing wipes that usually either contain tea tree oil, they contain manuka honey, or sometimes okra, because all of these can help with inflammation, redness, and they also have some natural antimicrobial, antiviral properties. But they're very gentle at just cleaning the eyelids, removing debris, and even makeup from the eye. So there's many different products. One company that I've worked with, and no sponsorships or anything like that, but is for a company called Myze, M-Y-Z-E. You can go to their website. Help Myze is what it's called. But there's many different products on the market that I've either consulted with or that are available. And talk to your local eye doctor. They may have a brand that they've found works even better for their patients, maybe in their personal experience. So doing that on a regular basis is a good thing to be doing.
Love it. Awesome. Okay. Thank you for that, because we would have stopped recording and I've been like, oh no. So thank you. All right. Now, final thought to wrap this up, and then we'll do our rapid fire off topic questions.
So final thoughts, really, again, just make sure you are seeing an eye doctor, even if you feel like your vision is fine, right? You feel like you're seeing great. It's good to get that checked out, to check your eye pressure, make sure you don't have glaucoma, make sure the retina in the back of the eye is functioning, that if there is a risk of something going on, that they can catch it early, and just be able to at least discuss. Because if maybe you feel like you're seeing fine, because I have patients who come in and feel like they're seeing fine enough to drive, but they're really not seeing their best. Like, they're missing an opportunity to instantly improve the quality of their life, right? They may be able to see their family and their friends better. They may be able to perform better at work because they're able to see things faster, respond faster. Their safety may be improved because they can see better when they're driving. It affects every single moment of your life. And why not improve the quality of your life just with one simple consultation with your eye doctor, make sure things are staying healthy and working their best?
Awesome. All right. Our rapid fire off topic questions that I ask every expert who joins us. All right. What's the best thing you've done for your health this week? What's the naughtiest thing you've done related to your health this week? Not that anything's naughty, but the salad and fries of your week, if you will.
I like that. So this week so far, probably the best thing I've done, I would say, is I've hit the gym and taken my omega-3s and my lutein supplements. That's probably the best thing, honestly. Worst thing, I have neglected getting my regular sleep schedule in. I've had a family friend over and we've been prioritizing enjoying time together rather than me focusing on necessarily my sleep habits. So that's probably the worst one. But yeah, I've at least made sure my diet and taking the supplements I need to have been solid.
Awesome. If you weren't Dr. Eye Health, what would you do?
I've thought about this. I've questioned it myself several times. I probably would be in the arts of some kind, whether it be in video production or even just like a drawing artist of some kind. I think in a former life, I would have gone back and gone to art school instead of optometry.
I could see that. The YouTube, the whole thing. All right. Favorite book on any topic other than your area of expertise, or you could give us a fiction book.
So I know they made a really obviously famous movie about it, was the book Dune. I grew up reading that when I was a kid. It was written in the 1960s by Frank Herbert. And of course, they made a big movie series out of it now that's done really well. I'm one of the weird people that even enjoyed the 80s movie. But the science fiction books, my mother was a big reader. My father was a big reader. So I got into those books when I was a kid. And yeah, I've enjoyed it.
Awesome. If you could cure one ailment, disease, or sickness, what would it be?
Oh, blindness.
Yeah. That tracks.
Yeah, I'm going to snap my fingers and just be able to fix all of that. Would be amazing. And I've had ideas of how that would work because, there's different types of blindness, but I don't know if technology's there yet.
Yeah. If you were a superhero, what would be your superpower?
I think, most dreams, if I have one, like a real superpower, it's probably that I could fly. I think a lot of people could feel that.
What's your biggest pet peeve?
Probably punctuality. Not just because, patients show up late, and we get that if they have car trouble or something like that. But it's just, I think I've always, and I feel even worse if I miss an appointment or if I'm late for some reason. I'm really hard on myself. As a young age, my parents drilled into me that no, you show up on time, you show up early. And so punctuality, people are running late. I get frustrated with it.
Yeah. All right. Last one, in your opinion, what's the next frontier in wellness?
I do think that understanding light therapies is definitely going to be, I think it's already somewhat here, like whether it be red light or yellow light, blue light, there's all these different types they're finding out more about different wavelengths and specifically different power densities and affecting different tissues of the body based on how much mitochondria is in every tissue and how it responds. And I think we're honestly at the very baby steps of it before we really understand its capacity and its applications, and definitely for the eyes and even the brain. So I'm excited to see where it goes, but I'm also very cautious because I'm not a cowboy in medicine. I don't like to just be like, oh, let's run with this. I'm like, let's really see the data, especially when it comes to safety.
I'm with you. Well, Dr. Joseph Allen, thank you for being here. Tell everybody how to connect with you, where to learn more, all of your stuff.
Thank you again for having me on. Certainly people can follow my content over on YouTube under the channel Dr. Eye Health. It'll show up faster if you spell out doctor. I'm also on Instagram. I'm on TikTok. I'm on all these different things. And then we're actually launching the Dr. Eye Health podcast very shortly. So be on the lookout for that one too if you're more of an audio listener.
Awesome. Yes. And we'll put links to everything in the episode notes so it's easy to find. And friends, on Friday, in this week's bite-sized bonus episode, we're talking about BTR Nation bars. So Courtney sent us a DM on the Salad with the Side of Fries Instagram about this one, asking if we have covered this brand before, and we haven't. So we're going to do that together on Friday in this week's bite-sized bonus episode. Be sure wherever you're listening, click the plus sign or the follow button, and then your app will alert you when it goes live. Well, as always, everybody, I'm your host, Jenn Trepeck. Connect with me on Instagram or all social media. I am at Jenn Trepeck, JENNTREPECK. Website is asaladwithasideoffries.com. Please send a message. I love hearing from you. Dr. Joseph Allen, thank you for spending your time and energy with us. Just truly appreciate you.
No, thank you. Appreciate you as well. And maybe someday I'll be able to have you on as a guest on my podcast too.
I would love that. All right, friends, if you are not already a member, join the Happy Healthy Hub. You'll go to asaladwithasideoffries.com/membership. This shows your support for this podcast, this community, and of course, your health. On top of this week's episode in full video with behind-the-scenes content, you'll get 24/7 Ask Me Anything and this week's recipe for the hearty white bean and kale soup. So until next week, remember, while it's often said, eyes are the window to your soul, now you know, eyes are also the window to your health.
Well, friends, that's it for today's episode of Salad with a Side of Fries. Congratulations for making yourself and your health a priority. Thanks so much for joining us. Be sure to click subscribe or follow on your favorite podcast platform. Share us with a friend, and we'll be back next week. Always remember, you deserve it, and you are worth it. Happy healthy.